How do tapes work? We know that tapes cure stress incontinence. There's been countless trials. They've been used for 24 years, but how do they actually work? Does anyone know for sure? Our hypothesis is that the intraoperative cure of stress incontinence by a sling or a tape is achieved at least in part by bladder neck closure. And to demonstrate this, we aim to correlate the perioperative reduction in the sign of stress incontinence with cystoscopic observations of increasing bladder neck closure. We had 40 consecutive patients, all having a Boston Advantage fit. You've got the age range there. 9 had tapes alone, but 31 had tapes plus vaginal repairs. Many had undergone previous continence procedures, with one having had 5. All procedures were performed under spinal anesthetic to allow intraoperative cough testing. Now, the repairs, if they were present, occurred before the tape, so the tape was the last part of any surgical procedure. We're looking at 2 parameters. One was the sign of clinical stress leakage at an exact volume of 300 mils, and one was the cystoscopic observation of bladder neck closure. We created 2 gradings for the 2 parameters. First, the stress incontinence grading. Patients were in lithotomy. Bladders were emptied and filled to exactly 300 mils. Maximal cough with 2 or generally 3 observers. Grade 0, SIG, was no leakage. Grade 1 was a few drops. Grade 2 was a small leak. Grade 3 was a moderate leak. Grade 4 was a large leak. Grade 5 was a large leak without a cough. For bladder neck closure, the starting point was the full circumference of the bladder neck came into view, and this was with the 70-degree scope we used for the rest of the sling procedure. We withdrew the cystoscope around 5 millimeters to obtain one of 4 scores. Score 1 was 0 to 25% bladder neck closure. Score 2 was 25 to 50% bladder neck closure. Score 3 was 50 to 75% bladder neck closure. Score 4 was 75 to 100% bladder neck closure. So these are the results. Firstly, for the stress incontinence grading, preoperatively the mean was 3.6, range 2 to 5. Post-op, mean was 0.5. This indicates a mean reduction of stress incontinence following the tape from a moderate to large leak with coughing to a few drops with coughing, and this generally correlates with the clinical cure of stress incontinence at follow-up. This mean reduction of 3.1 was highly significant. In terms of bladder neck closure, the preoperative mean was 1.9, the postoperative mean was 3.9, and this indicates a mean improvement of bladder neck closure from 25 to 50% to preoperatively to 75 to 100% postoperatively. And this mean increase in bladder neck closure of 2 score points was again highly significant. To give you an example, this lady had a strong leak, SIG4, preoperatively with a bladder neck closure of 2. Postoperatively, this SIG score was 0 and the bladder neck closure score was 4. Second example, a lady with another strong leak, preoperative SIG of 4 and a preoperative bladder neck closure of 3. Again, reducing to a small leak of 2 and bladder neck closure of 4, 75 to 100%. Late postoperative results, 98% were dry. The only one not dry was an 81-year-old with the 5 previous continence surgeries. There was no significant voiding dysfunction with a mean postoperative residual of 7 mils, range 0 to 72 mils, and no significant surgical complications. The interpretation of results is that the perioperative cure of stress incontinence by sling, as judged by the reduction of stress incontinence, is associated with increasing bladder neck closure. This is the first time that this finding has been clinically demonstrated. Other continence procedures such as bladder neck elevatory procedures, corpus suspension and periurethral injectables have appeared to work by bladder neck closure without similar confirmatory scientific studies. Our main conclusion is this, that the intraoperative cure of stress incontinence by a mid-urethral tape or sling is achieved at least in part by bladder neck closure, generally more than 75% bladder neck closure post-tape insertion. Thank you for your attention.